Emer, and we have a beautiful patient here today that is, a lot of my patients ask me about dark skin and pigmentation and how you can improve the complexion when you're at higher risk for using lasers. So our patient here today, if you take a look really up close at her skin, look at some of the areas a little hypopigmented or lighter in color, where areas like around her mouth and on her forehead are a little bit darker. This is very common in mixed ethnicities, Hispanic group, Indian, African American patients, and they don't know where usually to go because lasers can cause a higher risk of hyperpigmentation. So we're using a new peel called Enlighten that helps brighten the skin, and we're basically going to apply this in our gorgeous Vanna White.
Hello.
Candace over here is going to
moves.
apply, and this is very similar to what you've seen us use before. This is a high potency lightening agent, a combination of different ingredients that are active that are going to sit on the surface of the skin for a short amount of time, so you leave looking, well, I would love it to be purple because then you could say an Oompa Loompa, but you leave looking like you have carrot juice on your face. But this allows it to penetrate deeply into the skin, and actually massaging it in probably is very useful. And this will allow her to get cell turnover very rapidly. So your skin naturally turns over at a cell cycle of 21 to 28 days, meaning that every month you should be getting a facial because it helps you exfoliate the upper surface skin cells. If you use something like this that has a high potency exfoliator plus a lightener, you're going to exfoliate between days 5 and 10. Which means that if you're using this and then applying lightening agents and exfoliants like retinol afterwards, within 2 weeks, you're going to have much brighter skin, as opposed to doing things like a laser with a topical cream, which could take up to 6 weeks to 8 weeks to see the ultimate outcome because of that 21 to 28 day cycle. That's why we do these type of lightening peels, not only to brighten the skin pretty quickly, but also to prepare our darker skin complexions for laser treatments, because there are some lasers that can be used, and there's also some peels that can be used in darker complected skin individuals that this really just preps you for. And some of those lasers include videos you've seen of us recently. Aerolase, which is a microsecond YAG laser that specifically works for hair removal, veins, and pigmentation. Also some dermal heating, which means just skin tightening. But also Clear and Brilliant, which is a non-ablative laser, meaning it doesn't burn the surface and only heats it so that you get light exfoliation. And honestly, we do what we call sometimes the Cosmo Peel, which is a combination of Clear and Brilliant and this lightening agent at the same time, at the same day, so that you get even more penetration into the skin, and the results are pretty phenomenal.
That's awesome.
And so this is a nice thin film. We're getting it to be evenly distributed. We're massaging it into the skin. Is anyone saying anything or no?
No.
No. They're that happy?
They watched it a little
They've
bit ago.
already seen it?
Yeah.
Okay, well.
And she doesn't feel any stinging. There's
How does
no
it feel?
No,
pain with
it
this.
just feels really fresh.
Feels fresh.
Yeah, I like it.
So maybe we need to get
Perfect.
carrot juice at the same time.
Yeah, absolutely.
Sure,
Or a martini.
I would prefer that.
So what are you excited about with this peel? What have you been told?
That I would get an even skin complexion.
More even skin
yeah.
tone. What else?
And then
Anything?
it would reduce the pigmentation I had like on this cheek.
Why do you have the pigment? Acne?
Acne
And acne
scars.
scars. Yeah, so this is great for my acne patients, acne scar patients. Actually, the active ingredients here will treat acne.
And also salicylic in it, correct?
Correct.
So
Yeah.
that's an added
So that's an added bonus. And salicylic acid, just so you guys know, a lot of people think of that as a peeling agent. It's actually a cooling agent. It's the only peel that's actually considered a cooling peel because it's from a tree that calms down the skin. It's actually anti-inflammatory, very similar to aspirin. So you can apply salicylic acid relatively high amounts to not only help penetrate other things into the skin, but also calm the skin down when you're doing something more aggressive like this. So not only can it penetrate more, but you'll get a better outcome. So now we're making everything really even.
Looks good.
And then she's going to go, and what she'll do is report back each day with a 30-second to 1-minute video on her Instagram and Larev's Instagram.
Yeah.
And she'll post a cute picture, and then we'll take a look at her in 14 to 21 days, and we'll see how good. The goal would be in 14 to 21 days to do an active peel or a laser right afterwards, and to start her aggressive skincare immediately. Okay? All right. Anything else? Candace, you want to add anything?
No, I feel like we covered the bases with this.
Looks
Okay.
great. I think it's really going to help her with her acne scarring.
I
yeah,
agree.
absolutely.
Yeah.
Brighten
And
everything.
a lot of patients come to me for acne scarring and wanting treatments, and they're nervous because they're darker skin. So this is a great initial starting point, or this is something you can do in between your treatments. A lot of times I'll rotate a laser with a peel, because remember I told you guys that life cycle of your skin. It's very important you get those cells continuously turning over. So the deep journal heating from a laser will take 6 to 8 weeks, while you peel at the same time on the surface. So you're getting both deep and superficial improvement. And that is why it's a secret to our patients and why they looked so good at the recent award ceremonies.
And the peeling on this peel isn't so horrific that you can't continue your day to day.
Tell them what's going to happen.
Right. So she's going to.
She does. She has to come day to day.
Right. So tomorrow she's going to, when she rinses this off tonight, washes it off, she's going to be a little red, have a little erythema.
That's it.
And then tomorrow she's going to have a little erythema, and she's going to start to kind of lightly flake and peel. And then the peeling will get progressively a little bit more intense over the next few days, but it won't get so intense that she can't live her day-to-day life.
Great. So
As long as she's not filming a movie.
that's fine. So, any other questions or anything else people should know?
Can be done anywhere on the body. Really good. Anytime you're treating the face, it's important to treat the neck and the chest. That's always the dead giveaway. Your face looks young and then you see the chest or even the hands.
Yes.
So we can do it on your chest, neck, hands, anywhere on the body, backs, butts, whatever. So.
We've done this all over, including lips, including genital area, which actually responds very well. And a lot of darker skinned individuals or hairy individuals that get pigmentation on the buttock. This is a great peel for that too, along with other peels that we have in combination with facials. So elbows and knees, a very good place as well, and then the creases of the armpits and the groin. So we can use this for pigmentation and improvement of acne or folliculitis anywhere. All right, you guys, thanks for tuning in, and stay tuned over the next week.